practices for 30 minutes. And assessment tools is BART, ankylosing spondylitis metrology index. It abbreviated as BASME. There are 5 components: traverse to wall distance, lumbar side flexion, modified Scoper test, cervical rotation, and intermanular distance, and the chest expansion. And the data is normally distributed, and we actually compare the pre-post within group.
এটা সাউন্ড খারাপ হয়ে যায় বন্ধ করতে পারি বন্ধ করবো তো ভয় লাগে তাহলে বন্ধ করি কোশ্চেন জিজ্ঞেস করছে
And the data is normally distributed, and we compare the pre-post session within group. That's why dependent pair sample test used. Okay, next slide. And this is the training protocol for the study. There is a few loosening exercise in yoga. We actually call it Sukshma Vyayama. After that, there are some asanas from the review study, and I am also from yogic field. From the few opinion of the experts, we actually frame this training protocol, and there are some breathing exercises also, because this is very important for the ankylosing spondylitis. Due to the ankylosing spondylitis, chest vertebra almost affected because there is a tendinitis and the other problem also occur. Okay, next slide. And this is the PASME calculated sheet, or this is the score sheet. We measure at the first, that is called the cervical rotational measure. We actually use the goniometer. After that, lateral flexion measure of the patient, and after that intermanular distance, and the fourth one is the modified Scoper test. We actually try to measure the spinal flexion, because the spinal movement is very much restricted for the ankylosing spondylitis patient, because the spine are almost rigid and it is very much stiff and also fused for the ankylosing spondylitis patient because of the inflammation. There are lots of inflammatory markers like ESR, CRP, TNF alpha. In our next study, we actually incorporated the variables. Okay, next slide. And this is the chest expansion we measure from the patient from the samples. At first, we instructed the patient, please exhale as much as possible, and after that, please inhale. And at first, we during the maximum exhalation, we measure their chest, and after that, the maximum inhalation, we measure their chest, and in between the range, we actually incorporated in our answer. Okay, next slide. And this is the demographic characteristics of our patients. Age, mean age 28.2 plus minus 7.4, and BMI 24.12 plus minus 3.12, and the duration of the disease 6.94. Okay, next slide. And this is the result of the spinal mobility, that is PASME in pre-condition. Before applying the yogic intervention, the result is 2.97, and after yogic intervention, it is 2.12. Actually, it reduces, but in PASME scale, that means the spinal mobility is increases, because if you see the PASME score, please go back, please go back. Yes, if you see the PASME score sheet, where the spinal mobility or the lateral flexion is so much high, their score should be small, like 0, 1, and where the measurement or the length is very much low, their score should be high. Okay. Alright. Yes. This is the spinal mobility, and it is significant as 0.0. That means the lower 0.01 level. Okay. Next. This is the result of the chest expansion, where at pre or the before, that means the before yogic intervention, this is 2.53, and after applying the yogic intervention when we measure it, it is 3.26. That means the chest expansion is increases. Okay, next slide. And this is the discussion part of our lesson. Actually, this is a experimental study, and this is a pilot study also. Our study is going on, and the 3 months data already collected. And from these variables, we also added some variables like inflammatory markers, physiological markers, and the psychological markers also. And one study published in the British Journal of Rheumatology in 1993 by Russell et al. Suggests that vigorous exercise can have the immediate post-exercise effect on improving the range of movement for the patients with ankylosing spondylitis. And in 2022, Singh et al. Conducted a study on ankylosing spondylitis patients and reported
শুধু ছবি
significant changes in the spinal stiffness after 1 week of yogic practice.
আমার উপর করবো না তোর
We actually examine the patients
কেউ করে দেবে
with yogic intervention, how immediately affect their spinal mobility and chest expansion. And already I have said it that this is a pilot study, then to examine whether there is any effect. And after discussion, at the end of the discussion, I can say that high quality, large scale randomized control trials are warranted to establish the efficacy, safety, and the standardized protocol yogic intervention for the patient population. Next slide. And the conclusion, the findings of the study indicate that yoga can be used as a safe